Hello, I'm Dr. Zach Nelson, Clinic Director and owner of Vita Chiropractic. I wanted to send over a quick video recap following your first visit with us today. Since we completed your examinations today, our doctors have worked very hard to review your entire file and any findings on your examinations. At your next appointment, this is called your report of findings. We will review your findings with you, answer any questions that you have about those findings, as well as discussing your recommendations for your care to address the problem areas and any associated health concerns from those problem areas. Our team will review with you the cost of care as well as any insurance benefits that you may have for those recommendations. You see, one of the most common problems that we find is that the joints in the exoskeleton, now that is your spine and your pelvis, can lose their normal healthy positioning and their normal healthy functions. The joints can become fixated and restrict the movement. Now this is what's called a vertebral subluxation complex, or a subluxation. When this occurs, it can lead to inflammation, swelling, muscle tenderness, spasms, trigger points, stiffness of those joints, and then ultimately pain. We specialize in assessing your spine for areas of subluxation to correct very gently and very specifically with the utilization of a technique called torque release technique, where we don't have to twist, crack, pop a bunch of segments to reduce subluxated segments in your spine. What we do is provide a very gentle and a very specific adjustment on that segment that's restricted to get the joint moving and healthy. That's called an adjustment. A lot of our clients find that it's very gentle and extremely specific and very effective at helping them reduce subluxated segments so that they can have a lot less tension, a lot less inflammation, and ultimately a lot less pain. I do have to be upfront that chiropractic care in our office is not a done-for-you program, it's done with you. Meaning we're gonna give you stretches, we'll give you rehab, we'll give you some healthy habits that we want you to start working on outside of the office so that the work that we do in the office with your adjustments is gonna couple together with the work that we want you to do outside the office with your rehab and with the development of great healthy habits as well. When we couple all of this together, we call this the 3 legs of the stool of health in our office. If you can picture a stool, it has 3 legs, and all 3 legs are extremely important. The first leg is going to be the adjustments that we provide for you to reduce the subluxated segments to get your spine back to a normal, healthy positioning again. The second leg is an at-home regimen that we will provide for you that consists of stretches and exercises that you'll be responsible for. But don't worry, your at-home program with the rehab stretches and exercises isn't going to be overwhelming. We choose intentionally a few stretches and exercises to target the problem area first so that you can start to get some momentum going with your exercises at home and the repetitions ultimately. Consistency is going to be key with that. Now the third leg of that stool is ultimately going to be the development of healthy habits and behaviors, and also the breaking down of some bad habits and behaviors that may be contributing to your subluxation pattern. We call this the stress bucket. We have a proven process that will help you influence healing so that you can get results quicker and faster that are sustainable and consistent as well. And we're going to review that with you at your report of findings. I'm Dr. Zach Nelson, I'm the clinic director and the owner, and we'll see you for your report of findings visit.